David Zuniga, and thank you so much for having me here. And I'm honored to be partnering with the Breast Cancer Resource Center, which is an organization. I'm a clinical psychologist that I have been working with for over 20 years. And I can say firsthand that the Breast Cancer Resource Center is an amazing organization, and I'm grateful that you're utilizing their resources. To tell you briefly about myself, I'm a licensed clinical psychologist, and I'm actually a career change psychologist. I went to Harvard Divinity School, studied comparative religion, and worked for 10 or 12 years as an interfaith chaplain in oncology, palliative care, and hospice. And then in my 40s, back to school and became a clinical psychologist. Just briefly, I'll share for a while, I was a faculty member in the integrative medicine department at MD Anderson, and I'm going to be talking about integrative medicine today. And then I wanted to go back into clinical work, so I, went back into my own private practice. So I'm a licensed clinical psychologist, and I specialize in working with oncology patients and caregivers, and I'm honored to be here. Today, I'm going to be giving a talk entitled First Things First: Self-Care, Psychological Flexibility, and Mental Health During and After Cancer Treatment. And again, I'm Reverend Dr. David Zuniga, and I'm so happy to be here and partnering with the Breast Cancer Resource Center. I'm here today to talk about mental health and self-care and integrative medicine and what we call psychological flexibility during and after cancer treatment. And one thing, there's different schools of psychology. One school of psychology that I integrate when I'm working with cancer patients and cancer caregivers, and especially breast cancer patients, is what's called acceptance and commitment therapy. So to share a concept with you on psychological flexibility and mental health, one of the things we work on in psychology, and you can see this on the screen, is, quote, psychological flexibility means contacting the present moment fully as a conscious human being, and based on what the situation affords, changing or persisting in behavior in the service of chosen values. Clients gain the skills to recontextualize and accept these private events, develop greater clarity about personal values, and commit to needed behavior change. This is a definition of what we call psychological flexibility, which for cancer patients, especially breast cancer patients who face an array of treatment options, psychological flexibility is a powerful tool in your wellness toolkit. So when we think about psychological flexibility, that's kind of an academic definition, or if I may be candid, I sometimes think of it like the Serenity Prayer. We ask for the serenity to accept things that we cannot change, the courage to change the things we can, and the wisdom to know the difference. And so the key concept is there are some things in existence that we do not control. There are some things that are outside of our domain and control. We can control, and this is where self-care comes in and psychological flexibility. We can control where we put our thoughts and where we put our emotions to a high degree, and how we use our brain, the kind of things that we put in our brain and where we deploy our attention, our energy, our emotions. That's what we refer to as attention control and psychological flexibility. When we have that kind of control, we actually control a great deal. And so what I want to talk about, we're talking about psychological flexibility for cancer patients, and we're talking about mental health. And some of the things to think about in psychology are what we call change mechanisms. What helps us be in the world the way we need and want to be in the world? And I think the first place to start is what we call defining value directions. This is extremely important. For all of us, we have to ask, what is the story of our lives? What do we want our lives to look like? You or someone you love is going through breast cancer treatment. Cancer treatment is obviously tough. It's hard. It can be scary. Anybody can feel nervous when they get a cancer diagnosis. You may be doing chemotherapy or radiation. The side effects could be very challenging, surgery, things like this. When we're going through this difficult period of our lives, the first thing to ask ourselves is, what are the most important things? And similarly, What do we want this phase of our life to look like? When we're looking back on this part of our life, what do we want to be able to say we did, where we put our energy, where we put our time, where we put our emotions? What do we want the story of our life to look like? And what do we want as we're going through our cancer journey, this period of our life to look like? And that's really important because how we think about our life has a big influence on the way we experience our life. And another key concept for cancer patients is, whether you're Christian or Jewish or Muslim or Buddhist or atheist or, Democrat or Republican, whoever we are, whatever is your cultural background, we are meaning-making beings. We want to know that our lives matter. We want to have connection. We want to find happiness and joy in our lives. And we are all meaning-making beings. One thing that we want to be careful of in psychology and philosophy, there's the idea of just world theory. And just world theory is the idea that if we just work hard enough, if we're just organized enough and systematic enough, that everything will be okay in the end. And while it's certainly true that often, we get up, we go to work, we go about our daily lives, generally 9 to 5, Monday through Friday, our lives can be okay. But sometimes hard things happen to good people. And so I do want to say this right up front. You didn't do anything to cause your cancer. You didn't do anything to deserve your cancer. Sometimes bad things happen to good people. And I mentioned just world theory because, again, we're meaning-making beings. And when something traumatic, something grief-filled happens to us, we'll come up with a narrative so we can understand. Our brains are almost wired to be anxious. And sometimes we seek out knowledge as a form of control. But in that knowledge seeking, and knowledge is certainly a good thing for sure, but when we seek out an explanation, we'll sometimes even come up with an explanation that punishes us just out of trying to have a sense of understanding and control over the universe. So again, nobody deserves cancer, and you didn't cause your cancer. The truth is, cancer is unfortunately very, very common. Sometimes in human existence, hard things happen to good people. And so, again, what we're talking about right now is how we think of our lives, what is most important, what do we want our life to look back when we're looking back on it, and what do we want this period of our life, your cancer journey, to look like. Sometimes with my patients, I call it the death test because as a chaplain and as a psychologist, I've basically been working my entire career in oncology and end-of-life care. And we are all mortal beings. And when we get diagnosed with cancer, even if we have a very good prognosis in an early stage, cancer can be scary. And we sometimes think about things like death and catastrophic, scary things. One of the fruits of the fact that we're mortal beings is it forces us to ask the question, how do we want to live? What really matters in the end? Is the thing that's bothering me right now, is this really going to bother me 10 or 20 years from now? It can be a great clarifier. So I use the phrase the death test sometimes, like when we're at the end of our lives, what do we want our life to look like? What really matters? And having that kind of clarity, defining valued directions can be illuminating. And it can help make us more psychologically flexible because it can help liberate us from what matters and what doesn't. It helps separate those out, and it can help us be empowered to move in valued directions. And that brings us to the topic of acceptance versus experiential avoidance. And there's a couple of concepts under here that I want to illustrate. The first is what we call happiness and purpose. And some of this it's important to kind of define your terms because we can use these terms differently. For our purposes, thinking about psychological flexibility, happiness sometimes is defined as, when we think of happiness, we kind of think of being relaxed, which is a good thing, and kind of sensory pleasures. Um, but that kind of definition of happiness, while it's great, it's fleeting, it's impermanent, it's subject to change. And it's also kind of contingent on other factors. Purpose is very different. Living a purposeful life may not always be happy, and it may not always be fun, but it's always meaningful. So if you look at people like Mother Teresa or the Dalai Lama or Nelson Mandela or, great leaders in, psychology and psychology, people who changed the world and made the world a better place. They often, if you read their biographies or autobiographies, they often had great difficulty in life. They had great pain in life because they were doing the work that must be done. They were immersing themselves in the pain of the world and working hard to change it. So the distinction is happiness is kind of fun, but happiness is fleeting and light. And sometimes, not as meaningful as being purposeful. Purpose relates to the valued directions in your life. Why are you here? What is most important? What really matters in the end? And as nice as happiness is, and of course we all want to be happy, myself included, things won't always be happy for us. For example, if you're going through cancer treatment, it may not always be a fun time, but it can be a meaningful time. Right now, as a cancer patient, your job is to do the very best you can to take care of yourself. This is a time, as much as possible, for rest and healing, and you're enduring something, I would imagine, working towards the future. So those are my thoughts. And as you reflect on yourself, what is your purpose in your cancer journey? And that kind of brings us to a similar idea, which is the distinction between pain and suffering. This is a very subtle distinction, but it's an important one. The reality is, kind of like when we were talking about Mother Teresa and Nelson Mandela earlier, folks like that, when we are going to have pain in our lives, we get older, we get sick, like with things like cancer, we're going to have difficulty. Chemotherapy is not fun. Radiation surgery, even getting blood draws, waiting for your chemo to be made, these things are not fun. There is going to be pain and difficulty just inherent in the human condition. But pain is different than suffering. What's suffering is getting stuck in your pain, getting stuck in your difficulty, and then amplifying that pain and difficulty. So while we're all going to feel pain, we don't want to get stuck. We don't want to cling to things that are going to cause us even more difficulty. And this is really important for cancer patients because it is a hard path the vast majority of the time having cancer. And again, you are doing something meaningful just by enduring, just by getting out of bed in the morning, just by doing the best you can to take care of yourself, because you are worthy of dignity and respect, and taking care of yourself helps you take care of the other things in your life. We're going to talk more about self-care in just in a second, but that's kind of the difference between pain and suffering. And so then what we think about is, this brings us to the complicated idea of acceptance. Acceptance is very popular in our society, and my concern for acceptance is, well, we all want acceptance. Acceptance is a great thing. Acceptance almost kind of has taken on an unskillful path in our society. We almost use acceptance in a judgmental way, like a cudgel. We kind of beat people over the head with it in our society if we're not careful. Acceptance doesn't mean everything's hunky-dory. Acceptance doesn't mean, everything is kind of buttercups and rainbows and unicorns, and it's a 22-minute sitcom where all your problems are resolved. Acceptance is hard. Acceptance, I think of as willingness or gumption. It's a process that takes energy and commitment. Acceptance doesn't mean you don't feel pain. Acceptance doesn't mean you have to love chemo or you love radiation or, yay, I'm getting another surgery. That's not what acceptance is. I've worked in a hospice and oncology for over 20 years. That's not what acceptance looked like. Acceptance is bringing yourself back to your value-based path again and again and again. It's recommitting again and again and again to what matters most to you. And sometimes that is really hard. It may not be fun, but it is meaningful. It is purposeful. It is valuable. So if you're having difficulty in your cancer treatment, if you need help in your cancer treatment, that's not a sign of weakness. It's not a sign of deficiency. It's a sign of insight and strength and authenticity. Everybody needs help. It takes courage to ask for help. Good for you for utilizing organizations like the Breast Cancer Resource Center and other resources that are helpful for you. And so when we think about, I want to focus on a few last concepts. One is the idea of goals, and one is the idea of purpose. Goals are very, very good. I'm going to accomplish this chemotherapy. I'm going to sit on the phone for 2 hours while I wait for my insurance company to work stuff out. Goals are finite, discrete, objective measures that we can use to measure our progress and help make sure we're adhering to our value-based, purposeful path. Goals are good, but goals aren't the key thing. We want to be living a purposeful, value-based life as we cultivate psychological flexibility. If I was to say, when you talk about your purpose is like if I was to say to you, hey, let's go west. Well, we live on a round planet. You can go west for the rest of your life. It's a journey. It's not a destination. It's a way of living your life. So the way these things work together is you will sometimes have great difficulty as you're going through cancer or as you're going through life. But we want to bring ourselves as much as we can back to the path, back to our value-based, purposeful way of being in the world. And I want to talk a little bit about some research-based forms of self-care. How do we adhere to our value-based life? How do we cultivate psychological flexibility when we are going through difficulty? Well, we all need support. It takes strength to ask for help, and everybody going through cancer treatment needs help. And that's actually a sign of strength and insight, not a sign of weakness. So I want to talk a little bit about what we call integrative medicine. Integrative medicine, so I used to work at MD Anderson, and the way we defined integrative medicine at MD Anderson, and this is a common definition, is in oncology, you have traditional research-based forms of care: surgery, chemotherapy, radiation, immunotherapy, these hormone therapy, these different kinds of things. And they're great. They can save people's lives. They can help people live longer. They can make us more physically comfortable. That's traditional research-based empirical medicine in oncology. We also have what we call integrative medicine. Integrative medicine means there's all these other interventions out there. Some of those interventions actually have a lot of research behind them and can be beneficial, including for cancer patients. And the things I'm going to mention are beneficial. There's research showing their benefit for cancer patient. So if there's alternative practices or complementary practices out there that also have a lot of research, we call them integrative medicine, and then we integrate them into traditional research-based care. There are other forms of intervention that also have research behind them. You'll notice too, at the first bullet point of this slide, I wrote, when it comes to stress and trauma, the body keeps the score. The Body Keeps the Score is a great title of a great book I'll mention in just a second before we wrap up. But it was written by a psychiatrist named Bessel van der Kolk, and he's an expert on trauma. And Bessel van der Kolk's book, The Body Keeps the Score, which is at the end of the slideshow, is it's called The Body Keeps the Score because when we have stress, when we have trauma, things like cancer situations, it's not just a psychological situation, it's a physiological situation in our body. We hold stress and trauma and tension and grief in our physical bodies. So just like when you go through cancer treatment and you want to, you do chemotherapy, hopefully it gets all those cancer cells, and then you flush that chemo out of your body. In the same way, when we're experiencing stress or trauma or grief, we have often certain types of thoughts. Those thoughts use certain types of our brains and produce certain types of neurotransmitters, which then have a downstream effect in our physical bodies. We hold stress and trauma physically. So just like you flush chemotherapy out of your body, you want to flush those physiological conditioned reactions in your body out of your body as well. So things like yoga, Tai Chi, Qigong, massage therapy, any kind of movement-based exercise, also acupuncture, art therapy, mindfulness, and other forms of meditation. These are all ways of helping you, not just emotionally, not just psychologically, but they're good for your immune system, good for your biological health as well. They're flushing those conditioned stress responses out of your body. And then I just want to offer a few resources. These are applicable to cancer patients and also cancer survivors. These will be up here on the PowerPoint, but I just want to mention briefly the Anxiety and Phobia Workbook is a very holistic research-based book with meditation, nutrition, exercise, information on psychiatric meds. I use this book with my own clients. If you're interested in meditation, Dr. Richard Davidson, he's a neuropsychologist from Harvard. He wrote a great book called Altered Traits, and it's a very accessible for both professionals and lay people, the kind of science of what happens to your brain with different meditation techniques. Meditation is a very powerful tool for research-based tool for cancer patients. Mindfulness in plain English is a personal favorite. It's written by a Buddhist monk, but I've known people who are Christian, atheist, Jewish, all cultural backgrounds who've liked this book. Mindfulness is one type of meditation among many where there is a lot of research showing its efficacy. Stephen Hayes, who I draw a lot for even this presentation on psychological flexibility. Stephen Hayes wrote the research-based workbook, Get Out of Your Mind and Into Your Life. I've used this with a lot of clients. It's very good. John Kabat-Zinn is a retired neurologist from MIT. He's a professor emeritus. He's a real guru of mindfulness-based stress reduction. And then Bessel van der Kolk, he's a psychiatrist and expert on trauma. This is a very research-based book on, if you're interested in the research, written for professionals and lay people on trauma. There's some good apps out there. 10% Happier, Insight Timer. These are good apps for meditation and self-care. I do offer my own website, which is a free community resource and has free videos made by a professional filmmaker on guided meditation, including for cancer patients. And again, you already know about the Breast Cancer Resource Center, but I can't recommend them enough. I've worked with them for years. The Breast Cancer Center is a wonderful resource as well. So I just want to say thank you for having me today, and I wish you all the best on your cancer journey. Thank you.